Hello and welcome. It's 11 a.m. here in Seoul. I'm Ji-young at the Arirang News Center. We're breaking into our regular programming to provide you with the latest live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Yoon Tae-ho, the overall officer of disinfection of the Central Disaster Management Headquarters, will be briefing us on the coronavirus situation here in the country. We should be getting a breakdown of the number of new infections as of midnight, as well as any trends and possible updates and the latest on the vaccine campaign. Also, the latest social distancing measures and efforts that the government is making to contain the virus. Let's take a look at the briefing.
설명하겠습니다.
Let us now begin our regular briefing for April 30th, Friday. First of all, we have had some discussions in the government level, and here are some details. The government has decided on the new social distancing measures, and today, starting from May 3rd and until May 23rd, for the next 3 weeks, we will be maintaining the social distancing level, the current social distancing level, that is, level 2 in the capital area and level 1.5 in the non-capital area will be maintained until May 23rd. And the special virus preventive campaign period will also be extended for another week. And also all of the gathering bans and also group meals at corporate levels and also public institutions will last until this weekend. And here are some details of the background of why we came up to this decision. And for the time being, we have seen a relative slow increase of our daily cases. We have seen, compared to the previous week, a slight decline indeed in the number of daily cases. And we will believe that 3 weeks ago we have carried out the ban of the gatherings at the nightlife entertainment venues. And we believe that these measures have contributed to such a decline. And also starting from earlier this year, we were able to carry out preemptive massive testings, and we were able to identify patients at an early stage, and we were able to also decrease the level of fatalities, especially among senior citizens. And we also have many room for hospital beds, and especially for the intensive care units. We all have about 500 beds available for these care beds, and about 800 hospital beds available for patients with mild and moderate symptoms. And we believe that these reasons are why we had to be very delicate and considerate in deciding the future social distancing measure. And going forward, we will be also inoculating the senior citizens going forward, as well as other general public. And we believe that until we reach our goal of 12 million by June, we need to also take particular precautions. And we believe that right now we can handle about 1,000 daily tally with our medical facility and the medical capacity that we have right now. And if the total tally or the daily tally, that is, surpasses 1,000 by June, we will have no option but to lift and strengthen the social distancing measures. However, if we are able to maintain daily cases below 1,000 by June, we believe that we could have much room for easing the social distancing measures, especially starting from July. And yesterday alone, we had 241,967 people who have been administered with their first dose of COVID-19 vaccines. And until yesterday, we have about 3,056,000 people who have been inoculated with their first dose. And we have achieved our goal of 3 million by end of April. And we also had many doubts, there were many doubts or questions as to whether we could achieve these goals. However, we have succeeded in achieving our 3 million mark. And we also like to extend our deepest appreciation to all of the people who have took part in the government's rollout of the vaccination plan, as well as all of the medical professionals. And going forward, we also aim to inoculate 12 million by June, which is about 20% of the government's or the total population of Korea. And the government government will also exert its full efforts to achieve its goal. And we ask for your participation in getting the vaccines. And until yesterday, we had a total of 1,828 people who have lost their lives due to COVID-19, and we believe that about 95% were clustered in the age group of over the age of 60. And for the next 2 months, that is, we will be carrying out the vaccine rollout for the senior citizens, and we believe that this will help us to decrease significantly the number of people with critical or severe conditions. And we also would like to ease the level of nervousness and anxiety among the senior citizens. And we need to also see and believe that the vaccines could help us to protect our senior citizens from the COVID-19 virus. And if we have reached our goal of vaccinating these senior citizens, we believe that we can ease our social distancing measures and also return to a state of normalcy as soon as possible. To this end, we also would like to ease the visiting restrictions at nursing hospitals and long-term care centers. These centers and facilities have seen a significant decline of the number of new infections. And as for these facilities that have more than 75% of its residents and workers been vaccinated, we will be adjusting the timing and the frequency for the regular massive preemptive testings. And also, if the people have been fully vaccinated, we will also allow them to have physical face-to-face visits as well. So this means that either the senior citizen or the visitors have been fully inoculated, we will be enabling them to meet face-to-face. However, they need to wear the protective gears in order to also prevent any risks of infection. And all of the residents and the users of the workers at these facilities are also under a ban on private gatherings. However, we believe that we will be easing this going forward. And today we have had 642 new local infections, 19 new imported cases. And we also had 3 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. We are enjoying a spring weather right now. However, we are still battling against the prolonged COVID-19 outbreak. And we believe that it is very crucial for us to reach our goal of inoculating 12 million by June. And we believe that the month of May is the month for family, and we also believe that we would have many family gatherings. However, please note that if we ease ourselves or let our guards down, we believe that we can see a large massive outbreak as well. We ask for your particular precautions and also refrain from having gatherings as well. And also enjoy any physical activities that also increase the travel of respiratory droplets, not indoors but outdoors. And looking at the outbreak trends last year, we believe that there also has been a slight decline in the number of new patients during spring. However, this rebounded during summer, where there were the use of the air conditioning and people resorted to indoor facilities due to hot, scorching weather. So we ask for you to take particular precaution as well. And it is very important that we contain the virus in this month of May. And if we also smoothly carry out our vaccination rollout in June, we will be able to return to a state of normalcy very soon by July. We ask for your continued participation going forward. And the local authorities would also need to comply stringently with the quarantine measures during this month of May. And in Jeollanam-do Province and Sejong City, they also have had success in containing the virus, and they have a very low new outbreaks. And we also want to also acknowledge the efforts made by the public servants at these areas. So we ask for your participation as well. And if your turn has arrived for for the vaccination, we ask you to get vaccinated as well. And right now here in Korea, the vaccines that have been approved, all of them have been also certified for their safety. And in the UK, the AstraZeneca vaccines have been administered to over 20 million people, which is about 65% of all of the vaccine recipients. And right now here in Korea as well, the AstraZeneca vaccines have been administered to high-level government officials, including President, Prime Minister, and the heads of the Ministry of Welfare and KCDA. And I myself will also be vaccinated this afternoon. I once again would like to appreciate all of the efforts put forth by the medical staff members, and we will also exert our full efforts to enable the citizens to return to a state of normalcy. Thank you very much.
지금부터 질의응답 시간을 가지겠습니다. 배석자분께서는 단상 위로 올라와 주십시오.
That was the government briefing on the COVID-19 situation here in the country. South Korea reported 661 new COVID-19 cases on Friday. This brings the accumulated number of cases to 122,012. There have been 3 more deaths, raising the death toll to 1,828. We'll wrap up the coverage here. We'll be back at 12 p.m. Korea time for midday news with Mark Broom. Bye for now.